Dr. DrGarimaAsati welcome you all in my YouTube channel. Today friends, I am going to explain you about bipolar disorder, from which 3% population suffers, and I am going to explain it in English for non-Hindi patients. Friends, at first I would like to tell you what actually bipolar disorder is. So it is a maniac depression. In this, two phases occurs and one alternate with the another. There is a one phase of depression which alternates with the elevated or hyper elevated mood of the patient. Friends, before that, if you have not subscribed my channel till yet, kindly subscribe to my channel, press the bell icon to get the latest update of the videos, and kindly see the video till the last, because at the last I am going to explain some of the homeopathic medicines which can be helpful in curing this bipolar disorder. Bipolar means two poles. One pole is of hyper elevation or mania or hypomania, and another one is of depression. So patient suffers from one phase for 6 months and it alternates with the second phase for the next 6 months. So what is hypomania, mania or elevated mode? So in that, patient gets hyperactivated. He feels extraordinary charged, that is, feels extraordinary happy or irritable or getting more energetic, and because of that more energy he remains sleepless for nights together. That is elevated mode. Next one is the depression, that alternates with this hyperactive mode or the maniac phase. In depression phase, there is more of crying. Patient looks each and everything in a negative aspect and becomes more sleepy, becomes more dull and lethargic. But in that hyperactive phase, he was more energetic. These two are opposite of each other. And in this depression phase, there is a risk factor of attempting suicide or self-harm. Friends, now I am going to explain you about the symptoms of these two phases one by one. In this first stage, that is maniac phase, there is increased self-esteem. Patient gets easily hurt. His esteem gets easily hurt. Along with that, as esteem is heightened, so there is grandiosity. Pretentiousness is more. There is more superiority complex along with this phase. There is rapid speech and thought process is also rapid and fast because of the increased psychomotor activity of that person. So speech, thought, understanding all becomes rapid and fast. He answers in such a quick wit that we can't imagine even. Becomes impulsive. Delirious state is there. Along with it, there is less sleep. Becomes easily agitated, gets aggravated, and even anger also is on hyper mode. Along with that, there is excessive spending. He starts spending money just lavishly. Along with that, he becomes goal oriented, job oriented more. Short attention span, can't concentrate properly. And this stage can remain for 3 to 6 months period of time. But there are also some symptoms which can be prior or prodromal to this stage. Increased appetite, and along with that there is increased anxiety. Patient becomes hyper anxious in small things too. Along with that there is mood changes. So these are the prodromal symptoms before this elevated mood. And in this maniac phase, patient may become violent more. Now, in hypomanic phase, it is a time period for short duration, and this phase occurs for 3 weeks, 4 weeks or for a month. And in this, delusions and hallucinations can occur. Next is depressive episodes, and it also remains for the 6 months time duration. So in this there is more of sadness, patient gets more irritable and angry, and there is loss of interest in the previously engaged activities that create interest in him earlier, now create loss of interest now in this depression phase. Along with that, there is attention problem, concentration problem, self-loathing. He hates himself and tries to injure oneself, feeling of worthlessness. That is, I am nothing. Feeling of I am nothing. Along with that, there is thoughts of death, suicide, committing suicide or self-harm. And this major period, that is thoughts of suicide and attempting suicide, this may remain for 2 weeks or more too, and it may lead to suicide too. So this is the depressive phase. Sometimes mixed affective episodes can also occur. In this, mania and depression both simultaneously occur. But how is it possible? So there is a thought process of grandiose feeling. Along with that, there is depressive episodes and depressive feelings is also there. So what is there? There is excessive guilt, feeling of suicide, along with a grandiose feeling that I am superior. So these two thought processes are there simultaneously within a patient at the same time. And there is also mood swings along with this phase, and difficulty with impulse control. Can't control his impulse to suicide or do self-harm. Now friends, I am going to discuss about the causes of this bipolar disorder. So first and the prime important cause is child abuse. Any kind of stress, that is environmental factors, are also responsible for causing this bipolar disorder. Along with that, it can be genetic or hereditary. And it may be because of some of the drugs which can lead to this bipolar disorder. Along with that, it can be associated with any kind of injury or neurological problem, that is trauma, stroke, any kind of brain injury or infection. These all may lead to this bipolar disorder. Now friends, I am going to discuss about the diagnosis of this bipolar disorder. It is mainly symptoms based. Now there is a criteria to distinguish the bipolar 1 disorder and bipolar 2 disorder. So in the type 1, there must be one maniac phase along with depressive phases. But in bipolar 2 disorder, there is no maniac phase and one or more repeated episodes of the depressive phase. Friends, now I am going to tell you about the treatment of this bipolar disorder. According to allopathic treatment, there are lithium-based drugs, antipsychotic and antidepressant drugs, and psychotherapy. But it may be not so much beneficial. Now I am going to discuss you about the homeopathic cause, its treatment, and one of my cured case along with this. So the homeopathic cause of this bipolar disorder is dual personality feeling. Friends, now I am going to discuss you about one of my cured case of bipolar disorder. A female aged 69 years suffering from this bipolar disorder since last 5 years. She had a complaint of this bipolar disorder showing this alternating phases of elevated mood and depressive phase of the 6 months alternatively. So in this hyper elevated mood, she expands lavishly, gets frenzy from pain, gets excited, talks constantly, becomes more of social, becomes restless, and there is great anxiety along with this phase. And in depressive phase, she desires to kill herself, becomes more sleepy, gets dull, just want to lie down on the bed, does not want to get up, gets panic on getting up from the bed. Delusion, she is alone in the world, nobody is there to care her. and afraid to get up from the bed. These are all the symptoms of this bipolar disorders which she presented. In physical generals, patient is chilly and that chilliness is followed by burning. There is burning in throat, patient is thirstless, and there is constricted feeling all over the body. The incidence just before getting deceased with this bipolar disorder was she lost her son completely. He died at the age of 29. After that, she started suffering from this bipolar disorder. Her son was everything to her. That is, she can't exist without her son. That was the feeling of her when we take the case. And we got the delusion. That delusion, his existence begins at that moment. And the remedy given was Camphora 200. That's all about my case, and this patient got cured completely within an year of time. Friends, now I'm going to tell you about some of the homeopathic medicines which can be helpful in curing this bipolar disorder. The first medicine is anacardium. So the cause of this anacardium in bipolar disorder is child abuse. He is over-restricted by the parents and cannot take his own decisions by himself. He must be dependent on parents for taking any decision. There is always a dual thought process in the patient of anacardium. One is always good and another one is the evil one. Along with that, the person may be antisocial or cruel. There is lack of moral feeling. Along with that, there is delusion that he is separated from this world. So in such cases, anacardium can be of very much use. Next medicine is phosphorus. And phosphorus need is love and care. And if he not get this love and care, becomes sensitive to all emotions, anger, fear, grief. He becomes estranged from family. And in higher and advanced pathological cases in this bipolar disorder get misanthropy. There is aversion to all humankind and humanity. There must be disgust or hatred or aversion, or might be misanthropy. So in such cases, this phosphorus can be of very much use. Next medicine is stramonium. So he is having a delusion that he is left alone in this world. Fear of being left alone, feeling of helplessness like a child. There is a panic feeling, panic becoming in narrow places, fear of narrow places. Along with that, there is a danger feeling and sense of being left alone forever. So there is a danger and delusion of being left alone. It can lead to clinging, that is, clings to anything or anyone who is near to him. Along with that, he does not recognize anyone. So in such cases of bipolar disorder, stramonium can be of very much use. Next medicine is nux moscata. So in this, there is a sense of duality. She feels that she has two heads. She can be two persons. So there is a sense of duality in nux moscata. And there is always a changeable mood from grave to gay, from laughing to cry suddenly. There is an alteration of this mood. So in such cases, nux moscata can be of very much use. And the last medicine is gelsemium. So there is great depression in this, along with dullness, dizziness, drowsiness, excessive fatigue and tiredness. But it also gets alternate with happiness, and there is a confusion of mind in this. Patient does not want to talk to anyone but wants someone in the room. So there is always a dual thought process in this. That's all for today. We'll meet soon with a new topic, new subject. Kindly subscribe to my channel if not subscribed till yet. Press the bell icon to get the latest update of the videos, and stay connected to stay healthy. Thanks for watching.